Before taking a bath, remember this carefully or you may risk having a stroke. Bathing is an essential daily ritual for maintaining cleanliness and personal hygiene, especially for elderly individuals. However, what many may not realize is that the temperature of the water can play a critical role in the safety and well-being of older adults. For the elderly, taking a bath can present potential risks, including a stroke or other cardiovascular events, if the water temperature is not monitored carefully. In this video, we will explore the importance of checking water temperature before bathing and how it can significantly reduce the risk of stroke and other health complications. The elderly and stroke risk. As individuals age, their bodies undergo various changes, including reduced skin sensitivity, poorer circulation, and a weakened cardiovascular system. These changes can make the elderly more susceptible to certain health risks, including stroke. One of the triggers for stroke is sudden shifts in blood pressure, which can occur when exposed to extreme temperatures. Hot or cold water can cause sudden changes in the body's circulation, leading to an increased risk of a stroke. It's crucial for elderly individuals to understand the impact of water temperature on their bodies before stepping into the tub. Effects of hot water on the elderly. Hot water can be particularly dangerous for elderly individuals. When hot water is used, it causes the blood vessels to dilate, a process known as vasodilation. This dilation can lead to a sudden drop in blood pressure, especially if a person stands up quickly after soaking in hot water. The sudden change in position, combined with the dilation of blood vessels, can result in dizziness, lightheadedness, or even fainting. In the worst-case scenario, this could lead to a fall or other physical injury. Hot water can also worsen pre-existing conditions in the elderly, such as cardiovascular disease. For individuals with a history of heart disease or stroke, extreme heat can further strain the cardiovascular system, increasing the chances of a stroke. The body's attempt to cool down in response to hot water could elevate heart rate and blood pressure, causing added stress on the heart and blood vessels. For these reasons, it is essential to ensure the water temperature is at a safe level before taking a bath, particularly for elderly individuals. Effects of cold water on the elderly. On the other hand, cold water can also be harmful, though it affects the body in different ways. When cold water is applied to the skin, blood vessels constrict, causing a rise in blood pressure. This sudden increase in blood pressure can also contribute to the risk of stroke or heart attack. Cold water exposure can cause the body to go into shock, leading to a variety of symptoms such as rapid heart rate, shortness of breath, and a sudden drop in body temperature. Additionally, elderly individuals may have a diminished ability to sense the cold, especially if they have circulation issues. As a result, they may not realize how cold the water is until it's too late, potentially leading to adverse effects like hypothermia, where the body's core temperature drops to dangerously low levels. The importance of temperature regulation. For elderly individuals, one of the most important factors in minimizing the risks related to water temperature is ensuring that the water remains at a safe and controlled level. The water temperature for a bath or shower should ideally be between 90 degrees Fahrenheit and 100 degrees Fahrenheit, or about 32 degrees Celsius to 38 degrees Celsius. This temperature range is comfortably warm, providing a pleasant bathing experience without being excessively hot or too cold, both of which can pose health risks. To ensure the water temperature is safe, here are a few practical steps. Use a thermometer. Many modern bathtubs and shower heads come with built-in temperature controls, but if you are unsure of the water temperature, using a thermometer can be a simple and effective way to measure the water's warmth. Test the water. Before getting in, use your hand or elbow to test the water. These areas of the body are more sensitive to temperature changes and can provide a better gauge of whether the water is too hot or too cold. Avoid extreme hot or cold. As a general guideline, it is important to avoid water that is either too hot or too cold. Water that is excessively hot, above 104 degrees Fahrenheit or 40 degrees Celsius, can lead to serious health issues, as previously discussed. On the other hand, water that is too cold, below 60 degrees Fahrenheit or 15 degrees Celsius, can cause a dangerous increase in blood pressure. Both extremes should be carefully avoided to ensure a safe and comfortable bathing experience. Consider health conditions. For elderly individuals with certain health conditions such as hypertension, heart disease, or circulation problems, it's particularly important to adjust the water temperature to suit their medical needs. Consulting with a healthcare provider on the ideal temperature for bathing can provide personalized guidance. Install temperature-limiting devices. To prevent water from getting too hot, consider installing temperature-limiting devices in the shower or bathtub. These devices can automatically regulate the water temperature, ensuring that it stays within a safe range. Other bathing tips for the elderly. In addition to checking the water temperature, there are other important tips that can help elderly individuals bathe safely and reduce the risk of injury. Ensure proper lighting. Good lighting in the bathroom is crucial for elderly individuals, especially for those with vision impairments. Proper lighting reduces the risk of falls and ensures that the individual can see the water temperature and other hazards. Use non-slip mats. Place non-slip mats in the bathtub or shower to prevent slips and falls. A fall in the bathroom can lead to serious injuries, particularly for older adults. Install grab bars. Grab bars installed around the bathtub or shower provide stability and support when entering or exiting the bath. They also help prevent falls, which can be particularly dangerous for elderly individuals. Take shorter baths. Longer periods of immersion in water can increase the risk of fainting or dizziness. For elderly individuals, shorter baths or showers are generally safer. Hydrate before bathing. Dehydration can contribute to dizziness and lightheadedness. Drinking water before bathing helps maintain blood pressure and prevent adverse effects from extreme temperatures. For elderly individuals, checking the water temperature before bathing is crucial to avoid the risk of stroke, falls, and other health complications. Both hot and cold water can trigger dangerous changes in blood pressure and circulation, putting older adults at risk. By maintaining a safe water temperature and following simple precautions, elderly individuals can enjoy a comfortable and safe bathing experience while minimizing health risks. As with all health-related matters, it's important to stay informed and consult healthcare professionals when necessary. Bathing safely and thoughtfully is a small but important step in ensuring long-term well-being and quality of life for elderly individuals. How can sudden bathing impact blood pressure and stroke risk? Bathing is a daily activity that many people take for granted, but for elderly individuals or those with pre-existing health conditions, it can be more than just a routine hygiene task. It can be a potentially risky endeavor. One of the most significant dangers associated with bathing, especially when done suddenly or without proper precautions, is its impact on blood pressure. Blood pressure changes can strain the cardiovascular system, leading to dangerous situations, including strokes. In this video, we will delve into how sudden bathing can affect blood pressure and the increased risk of stroke, particularly for the elderly. Understanding these risks is key to ensuring a safer bathing experience for older adults. The connection between bathing and blood pressure. Bathing has a direct impact on the body's blood pressure due to the physiological changes that occur when the body is exposed to water, especially when there is a sudden change in temperature. When someone enters a bath or shower, the body's circulatory system must quickly adapt to the changes in water temperature, pressure, and posture. These adaptations can either raise or lower blood pressure, depending on the circumstances. Warm or hot water effects. Hot water causes blood vessels to dilate, a process known as vasodilation. This dilation allows more blood to flow through the vessels, which can cause a drop in blood pressure. In healthy individuals, this drop might not be noticeable, but for the elderly or those with cardiovascular issues, a sudden decrease in blood pressure can be dangerous. The blood pressure drop can lead to dizziness, fainting, or falls, all of which carry additional risks. In extreme cases, this can exacerbate the chances of stroke. Cold water effects. Conversely, cold water has the opposite effect. When exposed to cold water, the blood vessels constrict, vasoconstriction, causing a temporary rise in blood pressure. For elderly individuals with a history of hypertension or heart disease, this sudden spike in blood pressure can put undue strain on the heart and blood vessels, increasing the risk of stroke or heart attack. Changes in posture. In addition to the temperature of the water, the way the body changes position when entering or exiting the bath or shower can also contribute to fluctuations in blood pressure. Standing up suddenly after being seated in a bath or shower can cause a sudden drop in blood pressure, known as orthostatic hypotension. This drop can lead to dizziness and fainting, increasing the risk of falls, injury, or stroke. The impact of sudden bathing on elderly individuals. Elderly individuals are particularly vulnerable to the risks associated with sudden bathing. As people age, their cardiovascular system undergoes various changes, including reduced elasticity of blood vessels and a decline in the efficiency of the heart. These age-related changes can make it more difficult for the body to regulate blood pressure effectively, leaving elderly individuals at a higher risk of experiencing dangerous fluctuations in blood pressure during a bath. Moreover, the elderly may have a diminished ability to sense temperature changes, leading them to unknowingly expose themselves to water that is too hot or too cold. This inability to gauge water temperature accurately can lead to unexpected changes in blood pressure, further elevating the risk of stroke or other complications. Comorbidity factors. For elderly individuals with additional comorbid conditions like diabetes, hypertension, or cardiovascular disease, sudden changes in blood pressure due to extreme water temperatures can have even more severe consequences. These individuals may already have weakened blood vessels, making them more susceptible to the damaging effects of rapid blood pressure fluctuations. How sudden bathing triggers a stroke. A stroke occurs when there is a disruption in blood flow to the brain, either due to a blockage or a rupture of blood vessels. The brain requires a steady supply of oxygen-rich blood to function properly. When blood pressure fluctuates rapidly, it can put strain on the blood vessels, increasing the likelihood of a clot or rupture. When the body is exposed to extreme water temperatures, whether hot or cold, the blood vessels can either constrict or dilate suddenly, resulting in rapid shifts in blood pressure. These abrupt changes can trigger a chain reaction in the brain's blood vessels, potentially leading to a stroke. Hot water and stroke risk. As mentioned earlier, hot water causes vasodilation, which lowers blood pressure. This sudden drop in blood pressure can decrease blood flow to vital organs, including the brain. In elderly individuals or those with existing circulatory problems, this decrease in blood pressure may not be fully compensated for by the body's natural mechanisms. If the brain's blood vessels are already weakened due to age or cardiovascular disease, this reduction in blood flow could increase the risk of a stroke. Cold water and stroke risk. In contrast, cold water causes blood vessels to constrict, temporarily raising blood pressure. While this may seem harmless in the short term, it can lead to a dangerous spike in blood pressure, particularly in individuals with hypertension or cardiovascular conditions. The elevated pressure can increase the strain on blood vessels in the brain, making them more prone to rupture or causing a clot to form. Both scenarios can trigger a stroke. How sudden bathing can cause other health risks. Aside from the direct impact on blood pressure, sudden bathing can have several other health consequences, especially for elderly individuals. These include falls. A sudden drop in blood pressure, especially when standing up after being seated in a bath, can cause dizziness or fainting. This increases the risk of falling, which can lead to fractures or other serious injuries, especially in the elderly. Hyperthermia or hypothermia. Bathing in water that is too hot or too cold can lead to dangerous drops or spikes in body temperature. Hyperthermia, excessive body heat, or hypothermia, excessive body cold, can result from prolonged exposure to extreme temperatures and can cause severe health complications, including stroke. Dehydration. Hot water can lead to excessive sweating, which, in turn, can cause dehydration. Dehydration lowers blood pressure, making it harder for the body to regulate itself, increasing the risk of fainting or stroke. Tips for safer bathing for the elderly. To minimize the risks associated with sudden bathing, elderly individuals and their caregivers should take several precautions to ensure a safe and comfortable bathing experience. Control water temperature. Always check the water temperature before bathing. It should be comfortably warm, not hot or cold. Aim for a water temperature between 90 degrees Fahrenheit and 100 degrees Fahrenheit, 32 degrees Celsius to 38 degrees Celsius. Avoid sudden movements. Elderly individuals should avoid sudden movements when getting in or out of the bath or shower. Standing up too quickly can lead to orthostatic hypotension, increasing the risk of dizziness and falls. Take shorter baths. To reduce the strain on the cardiovascular system, it's best to limit bath time. Shorter baths help prevent prolonged exposure to extreme water temperatures and minimize blood pressure fluctuations. Consult with a healthcare provider. If you have existing health conditions, especially hypertension, heart disease, or diabetes, it's crucial to consult with a healthcare provider to ensure safe bathing practices. They may provide specific advice on water temperature and bathing techniques tailored to your needs. Install grab bars and non-slip mats. To reduce the risk of falls, install grab bars in the bathroom and place non-slip mats in the tub or shower. This provides extra stability and support while bathing. Bathing may seem like a routine, harmless activity, but for elderly individuals, it can pose significant risks, especially when sudden changes in blood pressure occur. Hot and cold water can both contribute to dangerous fluctuations in blood pressure, increasing the likelihood of stroke or other cardiovascular events. By being mindful of water temperature and taking steps to avoid sudden movements, elderly individuals can significantly reduce their risk and enjoy a safer, more comfortable bathing experience. It is essential to understand the connection between blood pressure and bathing and to take preventive measures to avoid health complications. With proper precautions and a little extra care, elderly individuals can continue to enjoy the benefits of bathing without putting their health at risk. What are the signs of pre-stroke symptoms to watch for before bathing? A stroke is a medical emergency that occurs when blood flow to part of the brain is interrupted, leading to potentially severe and lasting damage. The risk of stroke increases with age, and elderly individuals or those with pre-existing conditions are particularly vulnerable. However, strokes don't always happen suddenly. They can have warning signs, known as pre-stroke symptoms, that give individuals a chance to seek help and avoid severe outcomes. Being aware of these symptoms is crucial, especially before engaging in potentially risky activities like bathing. In this video, we will explore the key pre-stroke symptoms to watch for before bathing. Recognizing these warning signs early can help prevent the occurrence of a stroke and promote safety, particularly when dealing with activities that can affect blood pressure and circulation, like bathing. Understanding pre-stroke symptoms. Pre-stroke symptoms, often referred to as transient ischemic attacks, TIAs, are short-term disruptions in blood flow to the brain. These episodes typically last only a few minutes to a few hours and may resolve on their own, but they serve as critical warning signs that a stroke could be imminent. TIAs can occur before a full stroke, making them an important alert to seek immediate medical attention. Knowing these signs can be life-saving, especially for elderly individuals who may already have a higher risk of stroke due to factors such as high blood pressure, diabetes, or cardiovascular disease. When combined with the potential stresses and changes that bathing can place on the cardiovascular system, recognizing these symptoms before bathing can reduce the risk of stroke and related complications. Common pre-stroke symptoms to watch for: sudden numbness or weakness in the face, arm, or leg. One of the most common signs of a stroke is sudden numbness or weakness on one side of the body, particularly in the face, arm, or leg. This weakness or numbness often occurs suddenly and may affect only one side of the body. For instance, someone may notice that they can't lift one arm or that one side of their face droops. Why this matters for bathing? If an individual experiences sudden weakness or numbness before bathing, they may have difficulty maintaining balance or safely entering and exiting the bath or shower. A fall or injury could result from impaired mobility, further increasing the risk of complications. Difficulty speaking or slurred speech. Another key warning sign of an impending stroke is difficulty speaking or slurred speech. A person may find it hard to speak clearly, or their words may sound muddled. This could be accompanied by confusion or trouble understanding others. Why this matters for bathing? Difficulty speaking may indicate that an individual is already experiencing some form of neurological disturbance. Attempting to bathe without addressing these symptoms could lead to disorientation or injury. If someone is unable to communicate properly, they may not be able to call for help in the event of a fall or other emergency. Sudden vision problems in one or both eyes. A sudden loss of vision in one or both eyes, or the experience of blurry or double vision, can also signal a pre-stroke event. Vision problems often occur suddenly and may affect one eye or both, depending on which part of the brain is affected. Why this matters for bathing? Bathing involves navigating a space that can be slippery, and poor vision can significantly increase the risk of falling or injuring oneself. If a person notices changes in their vision before bathing, they should refrain from bathing until medical attention is sought. Severe headache. An unusually severe headache with no known cause, sometimes described as the worst headache of a person's life, can be a sign of a stroke. This type of headache is often accompanied by other symptoms, such as nausea or vomiting, and may be localized to one side of the head. Why this matters for bathing? A sudden, severe headache can cause dizziness or confusion, making it unsafe to bathe. The person may feel unsteady or unable to properly regulate their movements, increasing the risk of falls or other accidents in the bathroom. Dizziness or loss of balance. Dizziness or a sudden loss of balance is another symptom that can indicate an impending stroke. This sensation of lightheadedness or vertigo may occur suddenly and may make it difficult to stand or walk without assistance. It's especially concerning when paired with other stroke symptoms like weakness or slurred speech. Why this matters for bathing? Dizziness and balance problems significantly increase the risk of falling during bathing. If someone feels unsteady or dizzy, they should avoid bathing until the symptoms resolve or medical attention is received. It's important to prevent accidents by ensuring the person has adequate support if they must bathe. Confusion or trouble understanding simple instructions. Feeling confused or unable to understand simple instructions is a common pre-stroke symptom. This confusion can happen suddenly, making the person feel disoriented or unclear about their surroundings. They might struggle to comprehend what's being said to them or may not recognize familiar people. Why this matters for bathing? Confusion can make it challenging to perform daily tasks, including bathing. A person experiencing confusion may forget how to use the shower or bath safely or may fail to recognize hazards, leading to a higher chance of accidents. It's important to ensure that the individual is properly supervised or assisted during such times. What to do if these symptoms appear before bathing? If any of the above pre-stroke symptoms appear, it's critical to act quickly. Immediate medical attention is necessary to assess the situation and determine whether a stroke is imminent. The following steps should be taken. Call for help immediately. If a person experiences any pre-stroke symptoms, they should not bathe. Instead, contact a medical professional immediately, either by calling emergency services or seeking urgent care. Ensure safety. While waiting for medical attention, ensure that the person is in a safe position. Avoid letting them attempt to bathe or move around, as they may be at risk of falling or further injury. Keep them calm and comfortable until help arrives. Avoid sudden movements. Sudden movements can worsen symptoms. Encourage the person to remain seated or lying down in a stable position, and avoid standing up or changing positions abruptly. Monitor symptoms. If the person's condition changes, continue to monitor their symptoms. If they lose consciousness or their condition worsens, notify emergency services immediately and provide them with the details of the symptoms. Prevent bathing without assistance. If the person has a history of stroke or other health conditions, they should avoid bathing alone. Having a caregiver present or using assistive devices like grab bars in the bathroom can help reduce the risk of accidents. Preventative measures to reduce stroke risk during bathing. While it's important to watch for pre-stroke symptoms before bathing, there are also preventative measures to reduce the risk of a stroke during bathing. Check blood pressure regularly. Individuals at high risk of stroke should monitor their blood pressure regularly. Extreme changes in temperature while bathing can cause blood pressure to fluctuate, so keeping it under control can reduce the risk. Use temperature-controlled showers. Using a temperature-controlled shower or bath can help ensure that the water temperature remains consistent and comfortable, preventing sudden drops or spikes in body temperature that could impact blood pressure. Limit bathing time. Shorter bathing sessions can help reduce the strain on the cardiovascular system. The longer someone stays in a bath or shower, the more likely blood pressure fluctuations are to occur. Consider bathing aids. For those with mobility or health concerns, using bathing aids like shower chairs, non-slip mats, and grab bars can provide additional safety and support. Recognizing pre-stroke symptoms before bathing can be the key to preventing a stroke and ensuring safety, especially for the elderly or those with pre-existing health conditions. Numbness, slurred speech, vision problems, severe headaches, dizziness, and confusion are all critical signs that should never be ignored. Bathing, while a common daily activity, can be a risky endeavor for individuals who are experiencing these symptoms. By being aware of these warning signs and taking immediate action, individuals can avoid dangerous complications and promote a safer bathing experience. Why is it essential to avoid bathing immediately after meals? Bathing is a refreshing activity that many people enjoy as part of their daily routine, but there are certain times when it can be risky to jump into the shower or bath right away, especially after eating. While it might seem like a normal or harmless activity, bathing immediately after meals can put undue strain on your body, potentially leading to discomfort or even more serious health issues. For elderly individuals, who may already have compromised health, it's even more important to understand why waiting after meals before bathing is essential. In this article, we will explore the key reasons why it's vital to avoid bathing immediately after meals, particularly for those who may be at higher risk for certain health conditions like stroke, heart disease, and digestive problems. 1. Blood flow distribution during digestion. After eating, the body prioritizes blood flow to the digestive system to help with the process of breaking down food. This is when the body is focusing its energy on digestion and absorbing nutrients. Blood is directed toward the stomach and intestines, and less blood is available for other systems, including the skin, muscles, and brain. Bathing, especially hot baths or showers, increases blood flow to the skin and muscles. Why this matters? If you bathe immediately after eating, the body's blood flow may be redirected to your skin and extremities, away from the digestive system. This can slow down digestion and cause discomfort such as bloating, indigestion, or even nausea. Additionally, sudden changes in blood flow may cause dizziness, lightheadedness, or fainting, particularly for elderly individuals or those with cardiovascular conditions. 2. Risk of low blood pressure and fainting. When you step into a hot bath or shower, the heat causes blood vessels to dilate, leading to a drop in blood pressure. Normally, the body compensates for this by increasing the heart rate to maintain adequate blood flow to the brain. However, if you've just eaten, the body is already working hard to digest food and may not have the necessary resources to compensate effectively. Why this matters? For elderly individuals, this combination of increased blood flow to the skin due to heat and blood diverted to the stomach during digestion can result in a significant drop in blood pressure. This could lead to dizziness, lightheadedness, and even fainting, particularly when standing up or getting in and out of the bath or shower. Fainting in the bathroom can be especially dangerous due to the risk of falls, which can lead to serious injuries, particularly in older adults. 3. Strain on the cardiovascular system. Bathing, especially with hot water, can increase your heart rate and put additional strain on the cardiovascular system. When the body is already using energy to digest food, the additional cardiovascular strain caused by bathing may overwhelm the body, particularly for those with pre-existing heart conditions or older individuals whose cardiovascular health may already be compromised. Why this matters? If someone bathes immediately after eating, they may experience increased heart rate, irregular heartbeats, or shortness of breath, which can be concerning for those with heart conditions. For individuals with high blood pressure or heart disease, the combination of digestion and bathing could worsen these conditions, potentially triggering chest pain or other heart-related issues. 4. Discomfort from digestion and full stomach. After a large meal, the stomach is often full, and the digestive process is already underway. The act of bathing, especially when combined with hot water, may increase pressure on the stomach, leading to discomfort, bloating, or even acid reflux. Why this matters? For individuals who suffer from digestive issues like acid reflux, the reclining position in a bath or the upward flow of stomach acid due to the pressure of the bath water can exacerbate symptoms. Similarly, the relaxation induced by bathing may slow down the digestive process, leading to prolonged feelings of fullness, indigestion, or discomfort, which can make the person feel even more unwell. 5. Higher risk of falls and injuries. As mentioned earlier, a drop in blood pressure from bathing immediately after eating can lead to dizziness or fainting, putting the individual at higher risk of falling in the bathroom. Slippery surfaces, combined with impaired balance due to sudden drops in blood pressure or dizziness, can easily lead to accidents. Why this matters? Elderly individuals, in particular, are at a higher risk of falls, and a fall in the bathroom can result in serious injuries such as fractures, sprains, or head injuries. A fall can also cause lasting physical or emotional distress, making it harder for an individual to perform daily activities independently. 6. Impact on the immune system. The body's immune system works continuously to maintain health, and digestion places certain demands on the body's resources. When a person bathes immediately after eating, especially with hot water, they may put additional stress on their body's ability to balance its resources and fight off infection. Why this matters? For people with weakened immune systems, such as the elderly or those with chronic health conditions, the combination of digestion and bathing may put unnecessary stress on the body, leading to a higher likelihood of infections, colds, or other illnesses. Additionally, the sudden temperature changes involved in bathing may weaken the body's defense mechanisms, potentially leaving it more susceptible to illness. 7. Potential for dehydration. Hot baths can cause the body to lose fluids through sweating, and if an individual has not consumed enough water after a meal, they may become dehydrated. Dehydration can worsen other health issues, such as dizziness, confusion, and kidney problems, and can exacerbate the already significant strain that the body is under while digesting food. Why this matters? For the elderly or those with pre-existing medical conditions, dehydration can lead to further complications, such as heat exhaustion, urinary tract infections, or kidney damage. This risk is higher if the person does not hydrate properly before bathing after a meal. Recommended waiting time before bathing. To avoid these potential risks, it's generally recommended to wait at least 30 minutes to 1 hour after eating before taking a bath or shower. This gives the body time to properly digest the food and allows blood flow to stabilize. The waiting period may vary depending on the individual's health condition, meal size, and personal tolerance. For those with certain health conditions, like diabetes or heart disease, it may be wise to wait longer or consult with a healthcare provider about their bathing habits. Although bathing is an essential part of personal hygiene and self-care, it's important to be mindful of when to bathe, particularly after eating. Bathing immediately after meals can interfere with digestion, increase the risk of fainting or falls, strain the cardiovascular system, and even lead to discomfort or other health issues. By waiting a sufficient amount of time after meals before bathing, individuals can promote better digestion, reduce health risks, and ensure a safer bathing experience. For elderly individuals, or those with chronic health conditions, being aware of these risks and practicing good timing habits around bathing is essential for maintaining overall health and safety.